Hi everybody, my name is Guillermo Coronel, and today we are going to talk about risk of a thrombotic event after the 6 weeks postpartum period. First, we're going to talk about the definition. Pregnancy significantly increases the risk of thrombosis. This heightened thrombotic risk rises further during the postpartum period, which is conventionally defined as the 6 weeks after delivery.
Blood clotting is a natural process and may be triggered by the body in response to a cut or a wound. In a relatively complex process called coagulation, a plug is formed that stops too much bleeding from minor wounds. Sometimes coagulation is triggered inappropriately, and a clot forms in one of the large veins in the leg, pelvis, abdomen, or more rarely in the arms, when it's not needed to prevent blood loss. The medical name for this condition is deep vein thrombosis, or DVT. You may have already experienced symptoms such as swelling, pain, and discoloration of the affected arm or leg, indicating that you're suffering from a DVT. There are several factors that may increase your risk of developing a DVT. These include age, being overweight, extended periods of bed rest, such as during a stay in hospital, limited blood flow in a deep vein due to injury or surgery, cancer and some of its treatments, or a family history of blood clots. You may also be at an increased risk if you've had a prior thrombosis. However, it's also important to note that in many cases your doctor may not be able to find a risk factor.
As compared with the non-pregnant stage, the 6 weeks postpartum period is associated with increases by a factor of 3 to 9 in the risk of stroke, by a factor of 3 to 6 in the risk of myocardial infarction, and by a factor of 9 to 22 in the risk of venous thromboembolism.
This animation shows how deep vein thrombosis, or DVT for short, forms. DVT is a condition where a blood clot forms in a deep vein, usually in the leg. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. The deep veins pass through the deep tissues of the leg. They transport blood from the legs and feet back up to the heart. The superficial veins lie below the surface of the skin. Here we show the position of the leg veins. The deep veins run between muscles of the leg. Contractions of these muscles when we move our leg and ankle help to squeeze the blood back up towards the heart. The veins also have valves that prevent the blood from flowing back towards the feet. DVT is where a blood clot or thrombus forms in a deep vein. It partly or completely blocks the flow of blood through the vein. A blood clot can form if a vein is damaged. If the flow of blood in the vein slows down, and if the blood has a higher than normal tendency to clot. Here we show the blood clot forming in the vein. Many blood clots are small, and your body will usually be able to gradually break them down. Here we show a small blood clot being broken down, and the blood flow through the vein return to normal. Sometimes a larger blood clot can form. A larger clot can completely block the flow of blood through the vein. Here we show the blood clot growing larger. A large blood clot may cause pain and swelling in the affected leg. However, DVT doesn't always cause symptoms. This is the end of the animation. Click on the animation screen.
PROS guidelines for the treatment of thrombotic disorders during the pregnancy advise the discontinuation of prophylactic therapy at 6 weeks after delivery in women at high risk for venous thromboembolism. Cons. Case reports have suggested that an increased thrombotic risk may persist beyond 6 weeks after delivery. More thrombotic events occur within 6 weeks after delivery than during the same period 1 year later. Conclusions. Current guidelines advise that high-risk patients receive prophylactic anticoagulant therapy until 6 weeks after delivery, but these recommendations are based largely on expert opinion. Thank you very much.